So good afternoon, my name is Alicia James, and I'm the founder of an initiative called the PAM Project. And PAM stands for Preserve a Mom. It is a social enterprise that advocates and promotes the maternal mental wellness for mothers of color. And I wanted to say that, is there anyone in the room that has had an experience that they've wanted to explore but didn't because they didn't think it was a fit for them? Is there anyone? Well, 17 years ago, I took a volunteering assignment working for an organization called Women in Need. And Women in Need is a nonprofit organization that helps women that are in transitional situations in their life. They're homeless, they're dealing with domestic violence, drug addiction. And I was so excited to volunteer for them. And they took me through a 4-month period of background check and so forth. When they came back to me, they gave me the assignment to be a client mentor. And I first thought they should have given me something better. But I took the assignment. And for 2 years, I volunteered for a mom who was in transitional housing in the Bronx. What I learned in the 2 years that I volunteered for her was that she had a passion, something she really wanted to do. And one day, the site director overheard me encourage her to pursue that. As I was leaving, she told me, I don't want you to do that. That's how she ended up using drugs. I want you to help her with this. As a mental health, I was a mental health professional, but that bothered me. The following week, I went back to work and I sat in front of my computer and I started writing a 10-page concept paper of what I would like to see happen from others. Fast forward, 2010, that concept paper sat on my desk in my bedroom. The idea was so big, it scared me. I didn't think I could do it. And all these things that I didn't know how to do, I didn't have a background in nonprofit at the time. I didn't know any therapists. I didn't know any social workers. I didn't have a clue to how to get started. I didn't feel qualified. Well, that same year, laid off. My job gave me a nice severance pay, and my back was against the wall. And I said, what do I have to lose? So I tried it, and I tested out on a small scale, but it still wasn't enough. So to really connect me with my purpose, one day I'm shopping in Bloomingdale's, and I see another customer in the store. We started chatting and we became friends. And I started telling her about my idea, and then she started to cry. And I said, what's wrong? She said, I'm mentally ill. I froze. This woman was dressed to the nines, makeup flawless. I said, what do you mean? It kind of resonated for me that I have my own bias of what mental illness looked like. She told me that every day she used to take her meds. Twice a month she used to see a therapist. It convicted me because that was the concept paper that I wrote about. And it pushed me to say, you know what? This is what I'm supposed to be doing. Advocating for mothers and their mental health. And I needed to hear her story to encourage me to start my journey. And so I want to say to all of you here, whatever it is that you thought you can't do, you can. Even if you take baby steps with it, it's possible. Since that time, I launched my business. I have already 3,500 followers on social media. And every day, a mom shares her story.